Nursing students, if you're studying for NCLEX, you need to watch the entire video. If you can like and follow, that's even better. Let's look at question number 1. The nurse receives HON-OFF for 4 clients. Which client should the nurse assess first? Letter A. Client with asthma who is sitting upright, speaks in one-word answers, and has minimal wheezing. B. Client with pneumonia who has a temperature of 39.1 or 102.4 degrees Fahrenheit and productive cough. Letter C. Client with heart failure who has bilateral crackles and 2 plus uncle edema. Letter D. Client with COPD who has an oxygen saturation of 92% at 2 liters nasal cannula. Okay, so the correct answer is going to be letter A. Client with asthma who is sitting upright but speaks in one-word answers and has minimal wheezing. Minimal wheezing with severe work of breathing can mean poor air movement. One-word speech suggests impending respiratory failure. So airway and breathing comes first. Our next question. A client is 6 hours post-operative after a thyroidectomy. Which finding requires the nurse's immediate action? Letter A. Reports throat soreness when swallowing. Letter B. Has a weak, hoarse voice when speaking. Letter C. Develops inspiratory stridor and restlessness. Or letter D. Reports tingling around the lips and fingertips. Let's look at the correct answer. It's going to be letter C. Develops inspiratory stridor and restlessness. Stridor and restlessness after a NERC surgery suggest airway obstruction from edema, bleeding, or compression. The nurse should act first to protect the airway. So this is where ABC is taking effect. Let's go to question number 3. The nurse is caring for 4 clients in labor triage. Which client should be evaluated first? Letter A. Client at 39 weeks with contractions every 5 minutes and bloody shaw. Letter B. Client at 32 weeks with painless vaginal red bleeding and reassuring fetal movement. Letter C. Client at 35 weeks with blood pressure of 168 over 112, headache, and epigastric pain. Letter D. Client at 41 weeks with decreased fetal movement for 2 hours and no contraction. The correct answer is letter C. Client at 35 weeks with a blood pressure of 168 over 112 who has headache and epigastric pain. Severe hypertension with headache and epigastric pain suggests severe preeclampsia and risk for seizure, stroke, and fetal compromise. This client needs immediate evaluation. Our next question. The pediatric nurse receives report on 4 children. Which child should the nurse see first? Letter A. Child with suspected epiglottitis who is drooling and leaning forward. Letter B. Child with bronchiolitis who has mild retractions and nasal congestion. Letter C. Child with vomiting who has dry mucous membranes and decreased urine output. Letter D. Child with sickle cell disease who reports pain rated 8 out of 10. The correct answer is letter A. Child with suspected epiglottitis who is drooling and leaning forward. Drooling and tripod positioning suggest upper airway obstruction. The nurse should prioritize airway support and avoid actions that may worsen obstruction. Let's go to question number 5. A nurse is caring for 4 clients on an inpatient mental health unit. Which client requires immediate interventions? Let's go with letter A, client with depression who says, I feel calm right now and know exactly what I need to do tonight. Letter B, client with schizophrenia who is pacing and responding to voices that comment on clothing. Letter C, client with generalized anxiety who reports chest tightness during a group session. Letter D, client with bipolar disorder who sleeps 3 hours and plans several new projects. Okay, so let's look at the correct answer. It's going to be letter A, client with depression who says, I feel calm now and know exactly what I need to do tonight. Now, this is rational. Sudden calmness with a vague plan can signal suicide risk after the client has decided to act. The nurse should assess safety and stay with the client. Question number 6. A client receiving IV Altiplase 45 minutes ago reports a severe headache and nausea. Which action should the nurse take first? Letter A. Perform a focused neurologic assessment. Letter B. Decrease environmental stimulation. Letter C. Check the next scheduled blood pressure. Or letter D. Prepare the client for a swallow screen. The correct answer is going to be letter A. Perform a focused neurologic assessment. A severe headache after thrombolytic therapy can signal intracranial bleeding. The nurse should assess neurologic status immediately and activate the facility protocol. Let's go to the next question. The nurse is preparing to start an insulin infusion for a client with a glucose level of 522 milligrams per deciliter. Which assessment finding is the priority to report before starting the infusion? Letter A, serum potassium of 2.9. Letter B, serum sodium of 130. Letter C, urine ketones present. Letter D, respiratory rate of 28 breaths per minute with deep respiration. Okay, so let's look at the answer here for question number 7, and the correct answer is letter A, serum potassium of 2.9 milliequivalent per liter. And this is the rationale because insulin moves potassium into the cell and can worsen hypokalemia. A potassium of baseline, which is 2.9, increases dysrhythmia risk and must be addressed before insulin infusion. Our next question. The nurse is caring for an infant admitted with vomiting and diarrhea. Which finding is most concerning? Letter A. No wet diaphragm for 8 hours with letter G. Letter B. Capillary refill of 3 seconds after crying. Letter C. A temperature of 38.2 Celsius or 100.8 Fahrenheit. Letter D. Dry lips and increased thirst. Okay, let's look at the answer. The correct answer is letter A, no wet diaper for 8 hours with letter G. And this is the rationale. Letter G with decreased urine output suggests significant dehydration and possible poor perfusion. This finding needs immediate intervention. Number 9. A nurse enters the room of a client 1 hour after birth. Which action should the nurse take first? Letter A. Massage the uterus when it is buggy and displaced above the umbilicus. Letter B. Assist the client to avoid or to void after reporting bladder fullness. Letter C. Assess the perineum for a firm, painful hematoma. Or letter D. Reinforce teaching about expected lochia changes. Okay, the correct answer is letter A, massage the uterus when it is buggy and displaced above the umbilicus. So this is the reason. A buggy uterus after birth suggests uterine atony and risk for hemorrhage. Fundal massage is the first action to promote uterine contraction. Question number 10. The nurse is caring for 4 clients after surgery. Which findings should the nurse address first? A. Client after bowel resection with a urine output of 25 ml per hour for 2 hours. Letter B. Client after hip replacement with no confusion and oxygen saturation at 88%. Letter C. Client after appendectomy with a pain rated 7 out of 10 despite medication. Or letter D. Client after cholecystectomy with nausea after ambulation. So the correct answer is letter B, client after hip replacement with new confusion and oxygen saturation of 88%. This is why new confusion with low oxygen saturation suggests hypoxemia or possible embolic complication. Airway and breathing take priority. So how did you do? If you're able to comment your score in the comment section, that would be great. Thank you.